What's going on, y'all? So, this is 6 o'clock class. I'm just popping in here early. How you guys doing this week? Let me make sure my audio is up because y'all know how I am with the audio. Sometimes I sound almost muggled-ish. Yeah, I got a deep voice anyway, so y'all know sometimes I be on the phone, they think I'm a guy. But I hope you guys did your studying. You guys know that come the end of the month, by January, I'm going to cut those. I don't know what happened right here. I'm going to cut those things to private, right? So that's why I want y'all to go ahead and get in there and get in on those classes, because the billing and the medical terminology I'm getting ready to make private. Okay, because those classes go into Sapphire Academy. You have to be in the Sapphire Academy to look at those chats. Okay, I'm gonna put the website up there so y'all can take a look at that. Okay, when you go in there, also take a look at the bookstore. I hope I got this thing down. All right, hold on. All right, that's good enough. I need that extra light. That's why I got that on. So, I had a blast this weekend, by the way. My sister had a sneaker ball. Well, it was her, her entourage, they had a sneaker. I've never heard of a sneaker ball before, but they did. And the sneaker ball was amazing. Y'all should have saw me with my black Converses on in my satin dress. Boy, I couldn't get over it. But I'm gonna tell you something. We had a ball. Okay, it was a ball. We had a ball, and I definitely enjoyed the older women and the men that were there were also having a ball. Okay, the husbands. And shout out to my sister. Her website is The Real Shanika's Curvy Closet. Y'all check that out. That's for us. That's for the big girls. Okay. Well, wait a minute now. My sister lost almost 200 pounds. So I think I'm actually bigger than her now. I don't know. I think y'all know when I got to Georgia, all the cheesecake was crazy. I think I gained about 45 pounds. But I promised to take it off. I promised to take it off. Then no, I ain't giving no time frame. All right, so check this out. So I did why not today, and I did the why not today, and to deal with the why not, it was they are to buy the book for $39.99, and they can have a free tuition. So that's the same thing for you. You guys go on my website, get the book, and I'm gonna get an email anyway, and I'm gonna give you a download to join the program. Now, some of y'all who never did coding before, yeah, this is new to you. So you probably will need the medical billing and coding Q&A book. Like I said, that book comes with your program. Okay, if you buy the program right out, because right now it's staying at 99. All right, at the end of the year, that's different. I got to put it to $489. That's the regular price, the regular tuition. Y'all know that. Um, but right now, y'all know it's Christmas time. I always have some kind of promotion going on. So if you have not um, gotten in on that program, get it. And it has resources in there to help you. And we can also do a one-on-one. Now, I have had students that just feel like it's just too much for them, or they might get kind of overwhelming. But this is why I want you to break up your study. Break up your study. Do not try to study all at one time. Okay? Don't try to study all at one time. Just break it up, especially if you are going to work and you're going to do your classes in the evening. Okay? Because it's, what do you call it? Cramming. It's called cramming. I think that's what Kim was doing, cramming. And it's all about making time for your study. Okay. So don't forget, if you guys got any questions for me, make sure you hit me up with an email, physicians at sapphirecoding.com, or sapphire, what is it? Sapphire LLBC at gmail.com. All right. Um, we left off getting ready to do nursing. The basics of what I gave you, other than the nursing, is what's in that evaluation and management uh, class. Okay. Now, yeah, we get into the class. Now, the evaluation and management. Those of y'all on Twitch, y'all on TikTok. If y'all ain't get that, y'all make sure y'all archive those chats. The Now the coding classes will not be closed. Coding classes will not be closed until I close those classes. Um, the other two classes I'm going to close. In order for you to get into those classes, you have to join Sapphire. Okay? Why, Ms. Lambert? Because that's the only way you're going to get my link. Okay? The link is going to be private. Okay? The link is private. Okay? Whether I do it after this chat or not, I'm not sure. But the coding classes are starting right now. So I want you guys to get in on the coding classes. So we decided to go ahead and private the classes. So I haven't done it yet. I got to get coordinated to see how I'm going to do that. But it's Christmas time, it's almost the end of the year, and my choice is not to do it quickly. I just want to make sure that it's in order. Okay, and you guys are coordinated when you guys go into the Sapphire portal. All right, when you go into the Sapphire portal, you will be able to click on the link, and there you are in that classroom. If you do not have the link, you will not be able to get into the classroom. The link is in the Sapphire portal. Okay, the link is in the Sapphire portal. The YouTube will have the chats in there. Okay, they'll have the chats in there. So make sure you guys get in on that. I have some couple of older chats that are in there, and a couple of those older chats have the links in there for the books. Okay, but you guys can always go to my website and go ahead and get those books from my website. Go to the website and you click the little box to say bookstore and go to my bookstore. So in the bookstore, you guys know I have all the books are in there. The only book that's not in there is the CPC guide. I don't need to put that in there right now. I'm not at that point to get that in there. I have to order those books first before I put them in there. So probably next week. I'm supposed to get them in next week. So I'll put the CPC guys in there for you guys. But again, a lot of the books that you need is going to be in the Sapphire portal. So we supposed to have class a couple of days ago, but I was in transition of traveling and XYZ. So that's why we're having this class today on, what's today, y'all? Wednesday. We probably have class today, and I'm pretty sure I'm going to do class tomorrow. The nursing is not, I don't think it's that long, but again, it takes perseverance, and it takes retaining what you're doing. If you've forgotten what we did at the beginning of the class, archive that chat. You can run those chats as much as you want to. But those chats will be closed soon. Okay? So yes, I am encouraging you to go on the Sapphire Academy. I'm gonna put the let's get this out of here. I'm still gonna put those links that's up here for the ICD-10 books. Let me see how I want to go in. So hold on a minute. So let's take the caption down. So you guys see this was Friday's class. I'm gonna still put, why is that like that? I'm gonna put those links up there. Hold on. I got two datas for Word. That's why one of them is online and the other one is in my system. All right. And then when I go to the other one, the regular one that's in the system, it will not let me give y'all the books first. Okay, so I'm going to put the CPC link up there. You guys know I always put these links up there for you guys, especially those of you who are not familiar with ICD-10, those of you who are not familiar with CPT. Okay? I'm going to put this up so you can click on that link. You should be able to click on that link and take a look at that book. The purpose of this is for those of you who are not familiar with coding, who are not familiar with ICD-10, not familiar with CPT. Okay? They always have a delay, I'm telling you. Y'all gotta watch Amazon. I'm telling you, Amazon. I don't know how many things I ordered from Amazon, and either they getting taken or I don't know what's going on. But anything. One of these books is. All right, this might be it right here. The step-by-step book that you guys know I always use with you. Again, Kindle also has that that same book for you to take a look at. I've already ordered 2026, but we're not using that right now. I want you guys to still go ahead and use the 2025. Okay, I'm also going to put this link up here as well. This is a medical insurance billing book. Okay, this is a medical insurance billing book. All right, and these are, why is that there? I don't know. And these are the same books on Kindle. Now, you do not have to buy these books from Kindle. Okay, just get the Kindle, and it will give you about 30% of the book. And the reason I think that that's good is because those books cost a lot of money. Okay, and unless you join the Sapphire, you're gonna have to pay for those books. So this kind of gives you that first 30% of the book in case you say, all right, I don't want to do this no more. You have to waste your time buying the book. You got it from Kindle, and you can look at least 30% of the book. Now, the language of medicine book actually comes with your class. Y'all know that. Y'all know how I start these classes. We go with the links, we go with the so-and-so, and then we go into the classes. Okay? So, those of you who don't have your book, this is it. Okay? You can follow me or you can do it on your own. Now, if you guys need to have a DB with me, don't feel free, DM me. DB is discussion board. Okay? Discussion board is anything. Okay? However we need to have a discussion. You can send me a message, or you could, what do they call it when you get messages from YouTube? The DM thing? Okay. So it'll be the same thing. All right, you can DM me. Okay. After this, I don't know if I'm gonna be like tired or I'm just gonna be kind of getting my coffee and just kind of chilling. But I think I'm going to do the TikTok. I know TikTok. I've not forgotten about y'all. We had class the other day, but I had a couple of things that we have been doing. I went to, went to the sneaker ball and then all those kind of stuff that we did on the weekend. And I'm gonna do a separate TikTok for y'all. Y'all who didn't get in on the whatnot, I'm giving y'all the same thing for the whatnot because this Christmas time, y'all know always got something going on. So the book is $39.99. When you pay for the book, it's $39.99. You guys can go ahead and get the program. And yes, I am closing the classes. They will go to private. So you will not have access to these classes. These classes that we're doing right now, they're going to be free in here until I make them private. All of the classes that we are actually doing right now are in the Sapphire portal. Okay, they're in the Sapphire portal. Once I put the medical billing and medical terminology to private, you will no longer have access to that. So those of you who did not get in on that class, I would definitely take a look at those. I don't know if I'm going to do it after this video or at the end of the week. But my goal is to probably do it in January. But because people are asking me for them. And sometimes when people go in, there are people looking at them and somehow they're not opening. That's not the reason I'm closing them. Y'all already knew it was like a temporary thing for me to have them open. But I want y'all to get into the Sapphire Academy because that's your resource class. Okay, so even if I make those to private, you will have access in the Sapphire Academy. Okay, so don't fret because I have to make those private. Just know that you still have that discount. So that what is it? The medical book, the medical bill? Yeah. Hold on, let me put that. I forgot what it was. What is it? 29, 39, whatever it is. So that book, I think it's either 39 or something. Y'all look on my website. Y'all see how much that book is. However much that book is, I'm putting the courses in there for y'all. Okay, so y'all can medical Q&A book. It might be $39. I don't know. I can't really remember it offhand, but just make sure y'all get in on that because I'm going to make the classes private. Now, let's go ahead and let me go ahead and release this. Let me put this book back up here. Okay, so we are in evaluation and management. Okay, and you guys should be or should have been studying. I'm not sure which one it is. It's probably it's this one. So I don't know why that one is there. We'll get rid of that one. All right, so this is evaluation and management. What you guys know, we've worked in this for a minute now. Those of you who do have your step-by-step book, okay? So we're now in, I think we're now in nursing home. So let me see. You guys know where we left off at. We already did place of service. We did consultation, admissions, newborn care, office visit. Office visit is a face-to-face encounter between a physician and a patient to allow for primary management of the patient's health care status. Okay? New patient. Patient is one who has not received professional services from the physician or another physician of the exact same specialty and subspecialty in the same group within the past, what, y'all? 3 years. Absolutely. Okay? Same vice versa for established patient. Okay? Have to be seen within those 3 years. Medical record and documentation, we did. Patient information is located in the medical record. This information is referred to as documentation. Okay? If it's not documented, it did not happen. Okay? CODIS, y'all know the saying. Okay, the documentation in the medical record has many uses, such as evaluation of the patient's treatment, communication, and health care. Okay, much more, but we don't need to go through all that. Y'all should have read this by now. Okay, make sure you take heed to the MDM, the medical decision making. Okay, medical decision making. The elements of medical decision making remove the focus of adding up tasks and now focus on the elements that affect the management of a patient's condition. What they're saying is they're adding up what's wrong with the patient. Now we're going to see how severe it is, okay? And that's how we're going to make our medical decision to code this case, okay? We did this already. I'm just kind of backtracking. Y'all can look up these codes. I would look up all of these. 99202, y'all know that's new patient. 99212, established patient. Look at them. We went through this already. Straightforward, minimal risk, high, moderate. What's high? Well, if a patient comes in and the doctor considers him high, where he need to be going? He need to be going to the hospital. The provider need to go ahead and admit him to the hospital. He can do that right in the office. Right in the office, all these computers are connected. He can let them know that his patient is coming. Okay, once he releases that patient into somebody else's care, it becomes subsequent care because he is the initial admitting provider, right? Because y'all know we went through that. All right. Time may be used to report office or other outpatient services instead of MDM. Total time is used to report the code. Okay, the total time includes face-to-face as well as non-face-to-face. What's non-face-to-face? Phone, video, not standing with me. All right, so we're not going to go over all of that. I'm just kind of scooting down. Data to be reviewed. Y'all already saw that already. The following are some basic documentation guidelines. So this y'all supposed to have been reading while I was gone. Okay. Reading about diagnosis, laboratory, obtaining old records, results, direct visualization. Y'all supposed to have read that, okay? Risk as it is there a risk of death to the patient, morbidity or mortality, okay? And they're giving you what it includes, okay, right here. I know we did this. I'm just backtracking. Okay, I want y'all to go over this. Make sure y'all go over this. The referral for or decision to perform a surgical or invasive diagnostic procedure on an urgent basis should be documented. Okay, we know that. We know that. Okay, that's the levels. Y'all want to look at that. We looked at this already. Okay. So y'all got, I told y'all how to get that order sheet. Get the order sheet from, I think AAPC had one in there. I wanted y'all to read the one from AAPC, because that order sheet in AAPC is detailed. AAPC gives you a lot of explanation and they give you a lot of definition. It's not just an order sheet, okay? It's not just an order sheet. So that's why I want y'all to use that one, okay? So, like I said, a lot of this we went over. I'm just kind of backtracking. I'm trying to get down to nursing. And nursing, direct face to face, you guys did that. Nursing is pretty quick. But you guys have probably already did this. Office, other outpatient, new patient, you guys already did. Okay, so I'm trying to see what exactly in there, because we just went over that last night. Not you guys. Initial inpatient observation. Done, done, done. So we did nursing last night. That's a different class, not your class. This class is strictly YTU. So what's in here is just strictly for you guys. So you guys had a lot of coding to do as well. Based on what we did and what we just went over, you guys should be able to do the evaluation management coding by now. Okay. If you stuck, go back over some of those chats, or you can DB me. We talk about it. Okay, and remember I told you all about the CMS and the CMS. CMS doesn't do consultation codes, right? So just be precarious of that. You get that on your chest. You know you're not going to use it for Medicare. So we did ED, and we talked about ED before. So where I'm at right now, I know I'm in nursing, but I'm still kind of like scrolling through. You guys don't need to look at it. You guys probably have your book, okay? ED physician do not admit a patient to a hospital. If a patient is seen in the ED and has to be admitted to the hospital, the patient, PCP, or other designated physician will admit the patient. We just talked about it. Remember I just told y'all that? And again, you're going to combine what you have here once we get to our end courses with your CPC guide. Okay? You're going to do it word for word. So let's say how you study in this right here, evaluation and management. So you want this book out. You want your CPC guide out. This is for you guys who are working just independent. It might be like popping in and out of my class and you guys are independent. Okay? Critical care services, we talked about critical care services. So I do still want you to, those of you who did not get in on that, I still want you to look at those codes. Go look at 99281, 84, 83, 82. You remember we were talking about those codes? Other emergency department services. The critical care codes, look at those, 99291. 99292. Remember I was telling you the difference between those N codes. You see what it says 9192. When you get your test, you're going to start retaining that. You're going to know which code is which. You won't be in the dark. Your book will be in front of you. Your CPT will be in front of you. So if you guys don't have your CPT, open up that link. Okay. Which one is it? This one. So you can open up this link and it should give you the CPT book. Okay. And when you open it, you can see a lot of what we're doing now. Like I said, by the time we get to the end, you'll be done had your book already. Because this will give you enough of the beginning. So here, evaluation management is definitely in this book. Okay. I wonder why it opened like that. Hold on, y'all. I mean, y'all can go ahead. I'm just trying to see something. Y'all should be opening your books, okay? So I'm just taking a look at and see what this is right here. Well, look at the notes that I have on the bottom. If you go ahead and get your books, I put the ISBNs down. Dang what I'm looking for, but I did put the ISBNs down there. I'm looking for something else. Okay, so if you're gonna, there you go. That's what I want right there. Boom. Okay. So, hold on. I want to put this right. If you want to go ahead and buy your book, go ahead and buy your book. I put the IBN number down there. You can buy your book from wherever you want. You can get it from Amazon. You can get it from my website. You can get it from not CPT. You can't get from AMA, but you can get other books from AMA. Not the CPC got it. Not this one. Okay. Let me see. I don't know how that's 5. So when you pop up that link, this is what should pop up. All right, this is what should pop up. So you see on the bottom, right? It's probably gonna say, "What you got like 30%, of the book." And this is good, especially for those of you who have not gotten your book or can't get it right now. This book is gonna have at least 30% in there. So what we're working on right now in the coding, you can go ahead and utilize that book. Okay, same thing for the rest of them. I gave you the ICD-10, all of them are in there. Okay, we're not on HCPCS yet because I didn't think it was necessary to put that in there. Okay, what else is in there? Okay, so we can take that down. So I just want to kind of touch bases on that in case you guys didn't have your book. Okay, the step-by-step book is also in there. So I did put the step-by-step book in there so that you guys can have that. Wait, is that it right there? What is that? And like now, since it's like kind of like the end of the year, the books are going to go on sale. And y'all know I catch Amazon at 3 in the morning, just to make sure that you know let me see. I do 23, 24 in the step by step. I mean, nothing's really changed in the step by step. If a few codes change, you're going to have a new CPT book, so you can go ahead and match those up. But I wanted to kind of throw that up there. And again, you're going to get like 30 to 40% of this book. So, like I said, I have all of the links for you guys to get the free books, okay, until you get your book. Because there's no way you're going to do the class, without it. If you were in school, yeah, financial aid will be paying in your books, or if you get like the Tap and Pell, they will be paying for your books. But this is almost the same. They're practically free. Okay. Now, if you do Sapphire Academy, yeah, you would have your books are in there free. So I have found a way to put the books in there so you guys can look at the full. You guys can see all of the books. Okay. I'm gonna check it. Why I do that? I'm gonna check it tonight to see. I haven't heard anything. Y'all seem to be doing okay with the downloading, so I don't really have to do much to it. I don't know what happened right there. Okay, so let's continue on. Let's continue on. I just wanted to kind of throw that in so you guys can see that. Again, there's a code and shot there that y'all were supposed to do, 99292. Anytime you see, I'm up to nursing home now. This is where we at. Anytime, yeah, that's where I'm at. So anytime you guys see codes, go ahead and get them. Go ahead and get the codes. When I say get them, I mean look up the codes. If it's a code that's past evaluation management or admission or whatever, put the code in the search engine. Put it in it. What is this code? Or what is that new thing we got now? Grok? I don't know. I haven't tried Grok yet as far as codes. I do try Grok for other stuff. But put it in there so you can get the code. If you don't, if your book just is not going that far, I know they go up to 30%, but if you have your CPT book already, look up all the codes. And when I say look up all the codes, when you see a code in the step-by-step book, look it up. Because that's going to get you used to looking for codes. Okay, so again, we're up to the point where you should be able to code. We're up to the point where you should be able to code. No, not surgical. You should be able to code E&M. We haven't done the we haven't done that yet. So no. So Dawn asked a good question. Do we need to put this codes on the index card? No, you don't need to put the codes on index card to remember the codes because you're going to have your book in front of you. Okay, when you take your test, you're going to have your book in front of you, so you don't need to put them on index cards. But I mean, that was a good question because eventually you're going to be retaining them anyway. Yeah, because you're going to be going through your book like, you know, several times. Okay, so we're at nursing facility. I'm just going to put it up for a few minutes. Where is it? This is where we're at, and it's pretty much the same. You know, you just want to make sure that you read everything, all the guidelines, so that you know that you're coding how you're supposed to be. A nursing facility is not a hospital, but does have inpatient beds and a professional healthcare staff that provides healthcare to persons who do not require the level of service provided in an acute care facility. Okay? So, again, if you're going to code for nursing homes, stay with nursing homes. Okay? Just do nursing homes. Don't do nursing homes, hospitals, and physicians. You're going to get confused. It helps when you stick to that one specialty facility, not specialty. When you might have a clinic that he got 20 specialties. You might have a clinic that has one. But as far as the facility is concerned, okay, a skilled nursing facility, SNF. Put that on index card right there. Okay. It might be on your test and she might say, well, what's SNF? Okay. Is one that has a professional staff that often includes physicians and nurses. Okay. No, we're not going to read this whole thing. You are going to read this whole thing in your homework. Okay. So again, the reason for you to read this is so that you can be explicit on what a nursing facility is. Much different than a hospital. Okay, much different than a physician office. Okay, that's why they're giving you these guidelines as far as the differences. An intermediate care facility provides regular basic health services to individuals who do not need the degree of care or treatment provided in a hospital or skilled nursing facility. So this is different, right? You see, so they're different facilities. Okay, what I'm kind of shocked at is that they didn't put jails in here. They didn't put dormitories and jails in here because we code for them too. The long-term care facility describes health and personal services provided to ill, aged, disabled, or mentally handicapped individuals for an extended period of time. Okay, and that's what this part is basically telling you. Because when you get to your CPT, you're going to roll to that portion. Let me see something. Let me see. So you guys should still be on that. I'm just trying to see if use this for homework. Use this for homework if you don't have your book yet. I'm just trying to see if it will put you in the right place. Yeah. Okay, so it does. So let me see if I can get to this facility. Facility. This is homework, y'all. This is going to say yes. Okay, so look. This is homework. This is what you're doing tonight. Okay, so the book that I just gave you, it's 30% in there, but it is enough in there for you to do your homework tonight, for what we're doing in the class right now. So again, you're saving $100 and something in this book. Okay, you're saving $100 and something in this book. When you join the Sapphire Academy, this book is in there. This book is in there. Okay. But for those of you who are, even if some of you just joined my class right now, this book, I just gave it to you. That's what you're going to do your homework on. Okay, and I wanted to go in there to make sure it had a nursing home facility up there already. Okay, so again, don't sleep on those links. Okay, so here It's just giving you pretty much a guideline as to what these facilities are. Subsequent nursing facility care, subsequent nursing facility care codes 99307. Now, we're not sure if they're going to be on a test or if they're not going to be on a test, but I still want you to review these. 9 times out of 10, you may not see nursing facility stuff on the test, but you might get 1 or 2. If you want to know what's going to be on the test, go to the site. Go to the AAPC, look where it says test, and it's going to tell you AAPC. AAPC is going to tell you what's on that test. Okay? If you take that test and, God forbid, you don't pass it, you're going to get it the second time, but you're not going to get the same test. But they're giving you a roundabout of what's going to be on that test. So this is homework because we are going through the step-by-step book. The AAPC, or y'all can look for that chat that I did on AAPC. But you can always go to AAPC site, and they are going to tell you what's on their test. Okay? If it says nursing questions 2, okay, you know that's going to be on a test. So don't bog yourself with the nursing in that form unless that's the field that you're going to go in after these classes. Then you're going to bang yourself in the head with it. Right now, just chill out. Just go over step by step, okay? Just the nursing because it's class and I go over it, okay? Now, this is what I meant when I said I want y'all to look at the codes. So 99307 to 99310, it's in this book. I want y'all to look at the code. I want you to look at the codes and just read them. Just read them, okay? Because I'm pretty sure there'll be a couple of cases down here. And this is, again, 99315, Nursing Facility Discharge Services. This is getting you used to your CPT book. Okay, that's the purpose of you going as we're learning. So as you're training, before you even start implementing your skills in nursing facility, same how we doing, y'all know how I'm doing all the other classes. I want you to look at the codes first. Okay, nursing facility discharge code, service codes are here, 99315 to 99316. Report the services the physician renders to the patient on the day of discharge, right? Because that's like, it tells you these are discharge codes, so these are the codes that you're going to report on the day of discharge. The more you read it, the more that you'll be able to decipher how the coding goes. And you can almost put yourself in that predicament because you might have been there yourself. You know what happened when you went to the hospital or emergency room or something like that. Okay, so again, do not sleep on those books. Make sure you use those books. Okay, nursing facility service codes are also assigned for services in a type of place you would not think would apply psychiatric residential treatment centers. Okay. Anybody know what the psych codes are? We were talking about that on Twitter the other day. We were talking about somebody smoking, and they were like, what is his name? Kim Jong. He went to investigate a hospital that not investigate. He went to kind of check out the hospital that they were building. Was it North Korea? One of them, and he was like, where is the smoking facility? Where is the area for the patient to smoke? The patients have to smoke. They have to smoke. And it again, it's psychological. Smoking is psychological. It is. I ain't making it up. If you go to your CPT book, or those of you who have the full book, go to your F codes. Look at. Matter of fact, go to just diagnosis codes, not the procedure code. Go to your diagnosis ICD-10 and look up smoking. Look up smoking. Okay, I want y'all to look up smoking. Okay, in your ICD-10. Okay, look up smoking. Okay, tell me what's your beginning code letter. It's F, and it's in the psych section. Okay, see, I mean, I ain't saying everybody crazy, everybody smoking. You smoke whatever you want, but it's a form of, maybe calming mechanism, or just, I know y'all know I don't smoke, so I can't give you, insight on how a person is when a person is smoking. But I do know, I have heard, that it calms you down. It, relaxes you. I mean, that's exactly what he said. He was like, "Why is the smoking thing? They need the smoking thing. They gotta calm down." I know. Yeah, I know. I have all kinds of people on my Twitter, and yeah, I do follow North Korea. But again, make sure you guys steadfast on that, okay? So again, nursing, may not be a big portion of your test, okay, but it is in there. So I want you to also look up 99238. Y'all can write this down: 99238, 99239, 99304. I want y'all to look up those codes. Okay, look up those codes. When a patient has been in the hospital and is discharged from the hospital to a nursing home, okay, discharged from the hospital to a nursing home, all on the same day, you can report the hospital discharge and the nursing facility admission, okay, separately. This is also true for same-day services for patients who are discharged from observation status. Now, when you go to read your CPC book, it's not going to be detailed like this. The CPC is going to be direct, because what's in that CPC guide is what they want you to know to pass that test. This is more, because you're going to also need this while you are out there. So yes, I do want you to still look up these codes. When they say separate, it's on 2 different claim forms. Okay, same day, 2 different claim forms. All right, so nursing facility services. So they do have exercises in here. So again, same thing. I want you guys to do them. These are the exercises I want you to do. And again, the more you do this, the more you will understand the coding. The more you understand the coding. This right here, what we're looking at, is nursing home coding. Okay, it's nursing home coding. Okay, so in your training tonight, this is what you're going to do. How many exercises is it? Well, 1, 2. There's about 6 exercises that I do want you to go ahead and do with this, okay? So your next one is home services. So that was nursing in a nutshell, okay? And you can see it wasn't hard at all. All you're doing is reading the guidelines. You're reading the guidelines. We're going to go over this more in the Sapphire Academy. You see more stuff on it. You have more material on it. In evaluation and management, you have a whole document on this. All my class notes are in there, and it helps you. Okay? I know I'm trying to read you all at the same time. All right. So I want you to do this, okay? 99307, give that description. 99308, all you're doing is picking which one, okay? And remember, the medical decision making, if you forgot, go back over the chat, okay? The chats and the coding are not closed right now. They're not closed, okay? So go ahead and get them. That's why I want y'all to make sure y'all get in on the live. All right, so let's just kind of do like home services real quick. Only because it's in here, you guys can kind of do this on certain circumstances of home services. Anything can be home services. You can do dialysis at home. You can do physical therapy at home. You can do feet done at home. So, you guys can do that if you want to. Time spent to or from the patient's home should not be factored into the overtime care. This is generally just general reading. I kind of like to stick to what's going to be on your test. They may have something on the test as far as dialysis or patients with diabetes at home taking sugar or something like that, sugar tests and stuff. But this is just giving you insight on home services, okay? Go ahead and look up 99341 to 99350. So they actually give you a coding shot on it. That audit sheet that I gave you from AAPC, use that audit sheet with this. So the CPT code, even though they're giving you the CPT code is the procedure. What are they doing with the procedure? So this book should give you that code, because remember, we just looked at it. Those codes are in there. I I would think that they would give you more on this. They really didn't give much on the home services. But again, all of this is documentation. As a coder, this is documentation. Okay? You can't code anything without documentation. Okay? This class wasn't even long. I thought for sure it would be longer than what it is right now, but we really finished. The nursing home section wasn't even long. And the home service section, again, this is what you're going to do for homework. We're still not out of this. I think we're going to come up to documentation. Prolonged services. What's after prolonged services? Okay, see, my thing is I'm ready to get to documentation, but I want you guys to go through. I don't care how long it takes you. Go ahead and go through this book. But you guys probably have already done this. But again, just make sure you are doing the practice coding. That's why they call this book Step by Step. It makes sure that you are doing the practice coding. Okay. So because we still have like a good 20 minutes left, I want to continue on. Okay, y'all. Now, if you, like I said, if you haven't done medical billing, if you haven't done medical terminology, head back to the medical billing and the medical terminology. Okay, go ahead and do the medical billing and medical terminology if you have not done that already. I do have other chats that are already out there, but to do the rest of those chats, you have to know what's going on in the classroom. You have to have medical terminology to do the classes, okay? And like I said, when you go on the academy, they're already in there. All right, so you guys got a coding shot. So I want you to code that case study that's in there. You're also going to go ahead and do prolonged services, okay? In the prolonged services subsection, there are 4 subheadings. Prolonged services, clinical staff, services with or without direct patient, services other than face-to-face, okay? Prolonged physician services with or without direct patient contact. Now, prolonged services could be on your test, so make sure that you read it. So this is how you're going to do this. So let's say you're of the prolonged services, right, and you got your CPT book. There are guides in that CPT book. There are guidelines in that book to help you to more understand how you're going to code this. Prolonged services codes, you're going to look for the code 99415 to 418 are all add-on codes. An add-on code means that you're going to add this in addition to the primary code. Note, the plus symbol, you already know the plus symbol, okay? I'm going to show you what I'm looking at. You guys have your book already, so I don't really need to have this up here like this. That's why I just kind of took it down. In the bottom of your CPT book and in the beginning, there will be symbols down there, and they will tell you what those symbols mean. We were just talking about the add-on codes. There will be a plus sign by the add-on codes, which will indicate that it is an add-on code. That's what they're telling you right here. So when you do get to that in your CPT book, the link that I just gave you, remember that's a free book. Just take heed to that. So when you take your exam, you won't be in the dark. You won't be in the dark. Okay, you won't be in the dark because you're gonna have your book. You're gonna have your book up there with you. Okay, you have it with you. So again, this is the prolonged services that we're running through right now. I want you guys to do this part. They're giving you an example. The following example illustrates the use of these codes. So this I want you to know. An established patient with a history of COPD. What is COPD? Chronic obstructive pulmonary disease. Look in your book. Look it up. Make sure we're right on it. Look in your book, or type it in. Okay, type it in. Presents in an office visit with acute bronchitis and moderate respiratory distress. The physician conducts a history followed by exam, which shows a respiratory rate of 30, and labored breathing and wheezing, heard all in the lung fields. Okay, office treatment is initiated. It includes intermittent bronchial dilation and subcutaneous infringe. The service requires the physician to have intermittent direct contact with the patient for 95 minutes. Wow! The MDM is high. We knew that it was going to be high because as soon as he said 95 minutes, it's a wrap. I knew that the patient, even though it's anything in the chest area is going to be high, especially if your chest is hurting, you're going straight to the hospital. Okay, so as soon as we saw, I'm gonna put it up for y'all. So as soon as we saw this and we knew that there was a 95-minute, he took 95 minutes with this patient, the severity is going to be high. So, just kind of take heed to that. When you do your homework tonight, make sure that you do the reading on that and do the test that they have at the bottom. So here it is right here. So if it is high complexity, and we've already did the MDM, we've already showed some of the key terms. If we did 99212, 99213, 99214, 99215. It would be 99215. It's just telling you right here because he said 95 minutes, right? The MDM complexity is high, so the code is going to be in that 99215. So when you guys do your reading tonight, you will know that, okay? As the notes indicate, less than 55 minutes of prolonged services are not even reported, but are considered part of the initial service. So you cannot use a prolonged service code until after the first 55 of the prolonged services. Now, when you get your CPT book, highlight that. Highlight that. Why, Ms. Lambert? Because if you're on that test, and it's a question on there of when you're going to use your prolonged services, or you got a case, and in the case you forgot, you can't remember. Dad, when if you highlight it, it's already, the answer is already in your book. Every test that you get, and they give you open book, the answer's in the book. Your CPC, all the answers are right there in your book. But highlight it so you know right off the bat, because they're going to trip you up with all kind of codes, okay, that are not the code. All right. So let's get back in here. So again, just take heed to that. So tonight you are doing nursing facilities, right? You're doing nursing facilities and you're doing prolonged services. Okay. The direct prolonged physician service codes describe services that require the physician to have direct contact. That would be common sense to us, right? Good. Okay. And again, I'm gonna stop at standby services. Prolonged standby services. You guys go ahead and read that. But this is what I want you to do. These exercises right here. Let me make sure I got this one over there. Yeah, you guys can see what I'm looking at. So I want you guys to do these exercises that you see right here. Okay? Because this is how you're going to get used to coding. This is how you're going to get used to coding. Evaluation and management, okay, it was pretty long. It's pretty long. I still have 3 subjects to kind of go into evaluation and management. But if you have your CPC guide, I want you to go back into your CPC guide, and I want you to still take a look at. Ooh, my page is ripped. I want you to still take a look at prolonged services, case management services, care plan oversight. Non-face-to-face, not non-face-to-face, we did that one. Newborn care services we're going to look at, okay? The prolonged services, if you have your book, okay, prolonged services, the following categories of services into sections are the ones that we just did. If you notice, like I said, these books all work together. They all work together. Now, what we just went over was in a step-by-step book. This is the CPC guide. Now, I'm going to look at prolonged services. And you're going to see me say the same exact thing that I just said looking at your step-by-step book. This is a CPC guide right here. Prolonged services with direct patient contact with office or other outpatient services. It's the same thing that was just in a step-by-step. I'm just saying that to say all the books are together. Okay, codes in this category are subcategorized based on whether the physician or qualified healthcare professional has direct face-to-face service. See, it's the same thing. I know, but that's why it's going to be. That's why it's going to be repetitious. When I finish with this, we're going to do this, and it's just getting you to know what you're learning. Getting you to know what you're learning. 99417 is used to report prolonged services in time. Um, Highlight that. Make sure you look that up. I know y'all don't have the CPC guide, but I still want you to look up those codes because they're pretty much the same codes that's there. Okay, and don't forget, after 55 minutes, that's when you can use the prolonged code. Okay, to report a unit of 99417, 15 minutes of additional time must have been attained. They talk about the add-on codes. You remember we were just talking about the add-on codes? You got to add more minutes. You got to add more time. Because remember the 95 minutes? After the 55, that's why they had to put those add-on codes on there. Y'all got to join the class. Join the Academy class. And we go through it a lot more, okay? Go through it a lot more. Okay, that's prolonged services. Care plan oversight and all that. We're going to do that. But I just want to make sure you guys are clear on the prolonged services. Prolonged services are add-on codes reported in addition to time. So, when you, like I said, when you go past that 55, you know you're getting ready to put that add-on code on there. Okay. The final category of code for long services with or without direct patient contact care. Now, when you guys join the Sapphire Academy, I want you guys join the Sapphire Academy. We can go over it in more in depth. Once these go private, that's it. The classes are in there. Okay, the classes are in the academy because once they go private, I can't do the class like how I really want to do the class because I can't give away everything that's on here. But when we go in the academy, everything is there for you guys to do. But I still want you to take heed to the free classes that are here. It'll be the same classes that's going to go in there. But remember, these classes are going to be repetitious. When I come back and do the live classes again, it's going to come around again. Let's say the medical terminology. I'm going to make them private. I have to make them private, but then when it comes around again and I'm going to do them live, I'm going to do live for you guys here, but there will also be a live in the Sapphire Academy, okay? It's going to be different from this. I'm still putting you in the same place. I don't know what that is. I'm still putting you in the same place as I will be putting them, okay? So prolonged service and standby services. These are just exercises I want you to do, okay? These are exercises I want you to do. Let me see what this is. So read the case management services. I'm not going to go over case management services. You can go ahead and read that. The care plan oversight services. At time, healthcare professionals are asked to manage a complex case that involves individuals such as hospice patient care. That's like somebody with, diabetes. You need to have that oversight care. They pretty much got to work out for you. This is what the patient should be doing. Okay, and yes, that all has to be documented. Look at this code right here, 99374. All the way up to 99380. That's what you're going to be looking at. I know it's a lot. I'm not going to give you no more. I'm going to stop at that preventative care thing. Yeah, I think I'm going to stop right because that's too much. I'm giving y'all too much to do tonight. All right, so care plan oversight, domiciliary home or home, can have a care plan oversight. So you see how I'm kind of like combining the two books together. Okay. And they just tripped up and got the home services up here. And then they got the prolonged down here. But everything in the CPC is the same thing. Care plan oversight indicates oversight of the services provided to patients in certain location. Oversight of Oversight of patients in domiciliary, a rest home, or in a patient's own home, reported with codes from this category based on the provider's time within a 30-day period. So, yeah, I want you to highlight. If you got your book, highlight that because the question on the CPC might say, how long of a period is a care plan oversight? What you gonna say? 30 days. So that's why I want you to highlight that. Okay. If you don't have your book, write it down. Okay. Care plan oversight. CPO is care plan oversight based on the provider's time within a 30-day period. Okay. So get that down. You guys don't have the book. I want y'all to get that down. That sounds like something that I've seen on the test or it's going to be on the test. They want to know how long the period is. So some of y'all just came in. I'm looking at the CPC guide, which I'm just kind of letting you know how the CPC guide interacts with the step-by-step book. It's pretty much the same thing we're reading there, we're reading here. But the CPC guide is more direct. It's more direct, okay? So we're going to stop at. I'm not going to do preventative medicine because I've already given y'all a lot to read for homework. But I do want y'all to go ahead and put the care plan oversight in there because that might be an open and closed question on your test. Make sure you get that down. I already put the link up there for y'all to get the free books. Okay, those are free books over there. The CPT, the Hicks Picks, ICD-10, the Step by Step are all in the links over there. So don't forget, I want y'all to join the Sapphire Academy. Okay, get that book for $39, and I'm going to put you guys in the classroom. Go to my website so y'all can check out the books and everything because I'm going to privatize the classes. Right, Sapphire Code. Y'all know I hate capital. I'm going to privatize the classes because it's time for me to shut them down. January 1st, they're all supposed to be shut down, but I'm only going to shut down the medical terminology and medical billing. The coding will not be closed. Those classes will be closed by Friday, okay? Those classes will be closed by Friday, so make sure you get in on those classes. If you don't get in on those classes, you guys can definitely get in on the Sapphire Academy, okay? So this is where we are. It's 6:54. We're getting ready to shut it down. So don't forget, I want you guys to look up the codes. Okay. All right. So Chantel wants us to go on and do preventative medicine. No, we can do it. I'll have my regular chair, so you know this chair is driving me nuts. So preventative medicine, you guys know it's like your primary care provider. Preventative medicine is when you go to the doctor and they kind of check you out when they send you to go get your mammogram. They check you to make sure that you're not going to get sick. This is where you're going to go to tell the doctor, I need to be on weight loss medicine, or she's going to give you something, okay? This is just to stop you from being really sick. Preventative medicine services. So can you guys see where I'm at right here? Okay, no, we're gonna stop right here. We're gonna stop right here. That way y'all can go ahead and do this, and then we can I don't know what's next. Counseling is next. Okay. But this is easy. You guys can do. This is not a problem. All right. So this is the preventative care that we were talking about right here. And it's such a small part, so you guys can actually go ahead and do it. It's just pretty much telling you about the codes and preventative care. Hold on, let me get in there. Preventative medicine services codes. Look at them, and this is your giveaway right here. Look, you see where it says 8129-993, 81 to 99429. So can you imagine how many codes is in there? This is what I want y'all to do. This, okay? I'm still going to backtrack this when we come back again, because I want you to read every code in there. I want you to look at every code in there in preventative medicine. Preventative medicine, service codes 99381 to 99429. Report the routine evaluation and management of patient who is healthy and has no complaints. If the patient has a complaint and something is wrong with the patient, what does that preventative care code turn into? Evaluation and management. 99212, 99213, right? The codes in this subsection report a routine physical, maybe for the job, maybe they're just coming in for a physical, get your blood checked, get your blood pressure checked. Patient who is healthy and has no complaint. The codes in this subsection report a routine physical examination provided at the patient's request, such as a well baby checkup. Preventative medicine codes are intended to identify comprehensive services, not a single system review. That's why it takes a long time. The codes are reported for infants, children, adolescents, adults. They differ according to the age, the patient. And that's why I want you to look at that. Because they have one where it's the babies and then there's the infants, and the codes are similar. So that's why I want you guys to go ahead and look at all the codes in the preventative care medicine. Let me just see if... Okay, hold on, y'all. Let me see if you do have that. I think you do, and the reason why is because I'm throwing this in as part of your homework. So yeah, tomorrow I'm gonna come back on tomorrow because I want us to hurry up and get up out of evaluation management because I have to lock down the other classes. It'll take me a minute to do that. Um, is this it? Yeah. So it should have been in here right after this. Because y'all remember what I said, how she has this book. Let me open this up. The step-by-step book should be coordinated the same way this book is. Okay, so you guys see me? What I'm doing? Let me make sure y'all can see what I'm looking at. What I'm running through. Okay, yeah, that's your CPC book. What I'm running through is to see 99304. I told y'all to take a look at those. 99342. Take a look at that. 99345. We just did the prolonged service. So you guys remember what I said? All of these books are repetitious. All of them are actually repeating the same thing. So let me get back in here. So you remember what I said, the step-by-step book. Remember we just went through the step-by-step book. This is the CPT book. Is it not repeating the same thing from the step-by-step? See? The CPT guide. The same thing. It's the same thing. That is why you should have no problem passing that exam. Okay? No problem passing that exam. Join the Sapphire Academy. Okay? I have tons of resources in there. I need to give you tests. Okay? But now I'm still just kind of running through, and really I'm really kind of showing you as well. But again, the prolonged services, the same thing. 99415. Remember we was talking about 99415. Standby services, case management services, care plan oversight. Remember, we just finished looking at that. So that's why I say you're going to have these books in front of you. They're going to be repetitious. Okay, preventative medicine. This is where we are right now. Okay, I'm going to start right here. Preventative medicine. Okay, so if you have your CPT book, you got your CPT book because I just gave you the book. Everybody who reviewed it should have your CPT book, okay? Do preventative medicine services, okay? You don't need to have your CPT guide. The CPT guide is your advanced course. That's way down the line. I just got it open when I'm doing the classes with y'all. I like to kind of refer to it. So, oh no, I'm not going to hold y'all no more. Tomorrow, I'm going to try to do a class tomorrow. I hate saying that because next thing you know, something go down and then I can't do the class. Just look out for it, okay? Just look out for it. But again, here go your links. These same links is below. You guys hit me up. Make sure you guys check out my website, okay? Go to my website and go to my bookstore. Okay, I got to go on there in a few minutes, matter of fact. I got to go to the bookstore. Okay, you can order what you want from there. Everything you need is there. I made my website, my bookstore, one-stop shop. Okay, one-stop shop. You also can go to Whatnot. If you go to Whatnot, I got better discounts in Whatnot because they give me discounts on that Whatnot, so I got better discounts in there. All the books are actually in there. If you buy a book from Whatnot, the program is free. If you buy a book from Whatnot, the program is free. Okay, the medical terminology book is in there, and there's test and quiz in that book. Okay, go to Whatnot, type in Sapphire coding or Sapphire physician coding. I'm in there. Okay, purchase your book from there. You can purchase your book from there. You purchase your book from there, I'm giving you an ebook ASAP until you get your book in the mail. And I'm also giving you access to Sapphire Academy. Okay, so I'm gone. Hope you guys enjoyed this chat. I know I get missing in action, but don't sleep on that. I'm clicking it. I'm clicking it private. Okay, coding classes are still open.